Hello, everyone. Welcome to Doctor's Health Talk Show. I'm Dr. Farhan Tahir, joining you from Philadelphia. Today, it is my pleasure to have three of my class fellows, my friends, physicians, who would like to help you for anxiety and depression that is a major issue during the COVID crisis. This talk is primarily focused on physicians and healthcare teams, how to help them during this time of stress. And I welcome all of you here. Aamir, um, Aamir Sajjad is my class fellow. He's a psychiatrist in England. Monazza Ali, she is also a class fellow from Rawalpindi Medical College, and she's currently a psychiatrist in Sidra Medicine in Qatar. Sabine Ahmed, she's my class fellow from Rawalpindi Medical School and College and currently working as a radiologist in Lahore and also has great interest in mental health. So all three of you, thank you for taking the time to join me. How are you guys doing?
Good, thank you, Farhan.
Okay.
Thank you, Farhan, for having us on
Thank
your...
you, Farhan.
So Sabine, since you are on the grounds, you are actually understanding the situation in Pakistan. आपको पता है कि पाकिस्तान में क्या हालात हैं. We would like you to lead this panel today to ask our expert panel, what are the mental health challenges that our colleagues might be facing in Pakistan, जिसमें doctors हैं and other allied healthcare professionals. So kindly give us one liner of what made you think about this program and why do you want to contribute your time and effort on this today?
Thank you, Farhan, for this great opportunity, first of all. Well, because being a physician myself and connected to so many other colleagues and friends who are in this field, what I felt was that we are just like those, soldiers who are fighting with very little weapons, okay? And even then, the services are not regarded as they should be. And secondly, I also felt that in spite of all those efforts, still we have so many fears and so many anxieties. So that is why I found it a great opportunity, and I talked about it with you, and we discussed that we can have this panel with our experts, with our friends, Dr. Aamir and Dr. Monazza, and they can help us out how the healthcare professionals are going to deal with all these issues.
Well, thank you so much. I would invite you to start your questions and to our panelists.
Yes, just to give a brief introduction. As we all know that we are going through this difficult and crucial time of this pandemic of COVID-19. Till date, obviously everyone is having a look at the world meter, that there are 1,54,760 people in our country who have been affected. And out of these, 58,437 have been recovered and 2,975 have died because of this pandemic. Now, out of these, the healthcare workers, there are 4,144 who have been affected, of which 2,466 are doctors. So that makes it a major chunk. So I think it's a relevant time that we discuss the problems that we are facing over here. So first of all, I would like to ask Dr. Aamir that, Aamir, what do you think that what are the common health issues which are related to COVID-19 among the healthcare workers specifically?
Thanks, Sabine, and thanks, Farhan, for this opportunity. For COVID-19 pandemic, this is affecting everybody globally. So first of all, we need to really understand we are not isolated in it. Rather, it's a global thing and everybody is affected. So stuff that's happening in Pakistan and in other countries is pretty much the same across the board. COVID has affected people in several ways. One is whether I'm going to get ill, or if it happens to me, how would it affect my living and my household and my job? or there is another spectrum of COVID when people had been affected and how they have recovered, or if there had been unfortunate cases when somebody has had a fatality or serious became quite unwell, then how did they actually kind of what they got out of that in terms of mental health. So mental health has got that anxiety feeling to start with, which pretty much, I think, regardless whether we've been affected or not, everybody is on the edge, whether it's going to happen to me now or to my loved one or to my colleague, and how would I be adjusted and what would I have to do? So I think anxiety is massive. Anxiety is very difficult to separate from depression, and all the treatment modalities are pretty much focused to actually tackle both of these together. So depression goes hand in hand. And a lot of people, especially when you talk about healthcare workers, they have made some very, very difficult decisions. They had to make a decision whether this person needs any treatment or any specialist treatment, and this person doesn't need to be because their chances of viability is less. So they had to make that decision, which in normal circumstances might not have been a big deal. And that has left them a lot of trauma to deal with afterwards. So we are seeing a range of mental health issues in pretty much every field, especially in the people who are making health decisions, from anxiety, depression, and post-traumatic stress disorder. In addition to that, if somebody has already got an underlying mental disorder, we have seen that people been relapsing, and they are getting quite a few episodes when they need some extra support.
Thank you, Aamir, for the detailed account about this. So we can say that anxiety is on the top of the list, and as you said, that depression goes hand in hand. So next question, Dr. Monazza, I would like to know, like, how can we say that the anxiety that we are experiencing or anyone is experiencing, is that normal or excessive, and does it need to be addressed?
Thank you, Sabine. As Aamir said, I mean, this is very common. I mean, it's very common problem that people are suffering with anxiety, but it's also very common and understandable that we all are having some sort of anxiety to some level, which is kind of normal. And it's important that in that case is that you talk to the people like your friends or family members. But if you think that your anxiety symptoms are getting to a degree that you're suffering with them most of the time, most of the days for 2 weeks at least, then it's a time that one should be seeking some more professional help. And now how we will emphasize or how we'll know that these symptoms are actually more than a normal anxiety. So for that, I mean, first of all is that you're worrying, you are feeling anxious, you are feeling irritable, you're feeling all the time living in a fear just that you're going to get COVID-19, despite that you have taken all the measures for the prevention, and you've been reassured by your peers and by your hospital management that you're doing all the right things, but you can't just overcome that fear, and you're preoccupied with that all the time. People will find it that they can't relax. The sleep is one of the major factor which the staff, I mean, we have noted the healthcare professions, I mean, are suffering with, that they can't relax and they're suffering with poor sleep. And the lack of sleep obviously leads to the further issues later on. People find even when they go home, obviously hospital environment is stress, even they're at home, they're not able to relax. So there is constant stress which is building on more. They getting them more easily feeling angry and annoyed. And when they're going through all this, sometimes the anxiety start manifest in terms of the physical symptoms, and which are that they start to feel that their muscles are getting tense, they feel like tightness of the chest, which might be experienced as the chest pain, they find hard to breathe, the heartbeat can go fast, they might feel sweaty, they might have like, you know, pins and needles or numbness and these kind of feelings. So along with that, as Aamir mentioned, that with anxiety, the symptoms of depression are very common. So it's very normal, but where you feel very anxious and worried. You might feel actually very sad because you are very lonely and you're very isolated and you're away from your loved ones.
Thank you, Monazza. So that gives us a fair idea to our listeners as well, that the duration that you mentioned, almost around 2 weeks, and the other signs and symptoms, that if they continue like this and also go into the physical symptoms, so it's the time that we need to seek professional help. So further, just like I mentioned, Dr. Aamir, that our frontline workers, the doctors, they have fewer resources as regards the protective measures. So one of the major fears that we face over here is that we might get infected and we will transmit it to our family members. So this is the major, I also, when I enter my clinic, this is the first feeling that I have on a daily basis, right? So any guidelines how to handle this form of anxiety?
That's really very valid. And although you said it happens in your life, it happens to all of us, regardless whether we are working in radiology or in medicine or psychiatry. Uh, we need to work on the principle of prevention more than the care. And this is what we are trying to do. This pandemic is not actually, is not floating in the air that you will catch. It is there if you are in a vicinity of a person who is infected and he's got the potential to transmit it to us. But we cannot take our eyes off, because a lot of people, they're not symptomatic, although the guidelines are changing all the time. But we need to assume that every person has got the potential to transmit an illness, and you need to take precaution for yourself. By taking precaution for yourself, you're not only managing your own anxiety and outcomes of getting an infection, but also you are trying to prevent it spreading to other people. So there are a few things, very practical tips that all the healthcare workers and their employers should be doing, is to make the workplaces as safe as possible. We cannot say we are not going to be touching the people. A lot of us, we have to be actually in very close to the people, but we have to be mindful. If we have followed the guidance, have stayed away by 2 meters if possible, have used the proper precaution, PPEs, face visors, goggles, aprons, and gloves, at least that should give us some level of calmness that we have done our share of making this community and overall safer environment for all of us. But more than that, it is individual resilience and strength. We don't have to forget about that there are a lot of people who do not actually become very unwell. There are people who will get quite serious infection, and we need to be able to do risk assessment for ourselves, our family members, and for our colleagues, and we need to tailor our precautions accordingly. That's the way, that's the only treatment for now that we know is the prevention. Try to prevent catching it and try to prevent spreading it. But as I said, everybody's got a lot of resources, and we need to build up on our personal resilience to be able to cope with that.
Okay, thanks, Aamir, for the answer. And Monazza, I would like to ask you, being a female health worker myself, healthcare worker, like females, obviously, they have to take care of their homes, their children, and nowadays, like, there's added responsibility. We don't have any more facilities of the daycare centers, the caregivers, the maids that we were having at home. So as regards to this, how to alleviate anxiety during this phase? Like, a workload has also been, now it has increased. The work that we go on for our jobs, all the healthcare workers, included the nurses, allied health workers, doctors, and also all this burden of home as well. Even husbands are at home, the children are at home. So any tips to how to alleviate the anxiety on a day-to-day basis? This is for Monazza.
Yes. So Sabine, it is one of the, I think, the major problem which people are facing at the moment when they come to the clinic, that, the children are at home, the schools are closed, and it's a big challenge for the parents to meet up with the continuous homeschooling, especially if they have multiple kids, and then partners, like the husbands, they're also working from home, and sometimes both the parents are actually working from home, so, and they don't have a choice not to. So keeping up with their work commitment, keeping up with the children's homeschooling, it's a huge challenge. So number of things people can do. First of all, what I give advice to people is like, look, we need to prioritize what is the most important thing, at the moment. What can we, things which we can leave on the side, and the things which we can't leave at the moment. And there's a general concept of dealing with the worries is, if you have a worry, if you have a solution, okay, go ahead. If you don't have a solution to that worry, just drop that worry and try to not to think about it, because because what will happen, you will just ruminate on it and you will get more and more worry. Then in terms of practical way, the topic is so vast and we have a limited time. So we can't go into the details of the things, but briefly saying one of the things which came up hugely beneficial is during this time is to have schedule for both as parents, for adults and for children. So, it's important for us while we're at home, we maintain a routine. What time we're waking up, what we're doing first. If you're doing a breakfast, okay, what we're going to do after the breakfast. If you're going to start the work, how we're going to handle the kids, what they should be doing. So the kids should have their own schedule, which is very important, is that they should be part in terms of making the schedule for themselves. So, schedule, once we had it, I think that helps to put an order during a day. And then it's also very important is that we make sure that it's not full of just do things, and especially with the children. Because as parents, I think we are already anxious that they're not keeping up with the studies, but then we also add a lot of pressure on them. And in doing that, we need to keep in mind that if we are struggling with this social isolation, being isolated from other people, the kids are going through the worst. They are also kind of stuck in the house. So we need to respect that bit. So the social media or a social, IT, which is like usually, I wouldn't recommend that much, but to some degree, it's come as a rescue in this time period. But as parents, I think we need to prioritize it. We need to supervise it, that the way people are using these means, like they can use that to be connect with their friends, with their family members, and you can limit it times on other things, games and stuff. And you can balance it up that, okay, you do this, talk to your grandparents, talk to your friend and stuff like that. So that will help. And that goes into the part of this schedule. So all these things I think are very important. And then you should create some happy activities, relaxing activities. I think is very important during this time that you manage, that the whole family can participate in. So rest, we all know it's a hard time. Most of the people might not have help available at home, but we need to make the best use of it and look at the positive aspect of this. I will say at times, I tell people, look at the positive aspect of this COVID-19 lockdown situation. You might not get it again this much amount of time as a family. So think in those positive way, use this as a quality time spent with the family and improve your relationships with each other.
Thanks, Monazza. You're so very right that children must be facing it's a much more challenging situation for them. And I think now I got a fair idea, we'll get a great idea that if we schedule our day, so that would be a much, the children will also be living some sort of balanced life instead of the whole day they are on their laptops. And so, okay, I will also work on this, and I feel that this makes sense to me. Thank you so much for this answer. So next is for Aamir. Aamir, considering your experience in the administration, like I also work for someone else's clinic, and just recently 3 of my colleagues, they got infected with COVID-19. So all of us were really disturbed. So what steps can an organization take to improve the situation, like during this pandemic? What do you think as an employer or as an administrator, which will make their employees, relax and come back to work in an efficient way?
Thanks, Sabine, again. I think the crucial bit is leadership from employment, for the employment through the employers. You need to be able to be in a position to tell people what's right for them and implement practical plans. Monazza has really covered quite a bit of stuff, which is really important, and I learned quite a bit as well in terms of kids care. But when it's happening, all the employees or employers, we have to be mindful that at certain level, things have to be managed by themselves. You have to use your coping strategies, as we said, possibly your network, your resilience, and your personal strengths but that doesn't mean that you should not be seeking help. So must go and seek a professional help if these things do appear on top of normality. So don't really suffer in isolation. As an employer, beyond the leadership is what you can offer to your employees. I'll actually go through what we are doing, and I think quite a few of these things are quite easy to do, and people can do it. We know the mode of transmission. We know how can this be prevented. We also know that the closed spaces and the workstations and the closed offices, these are possibly the places where you're quite likely to catch the infection more than being in open places. So what we would suggest, look at your staffing and see, do everybody need to be present, or can you actually work either in a system where they actually take some shift pattern or can do some work from home? We have literally half of our office spaces are now gone, and that looks like a really very transformational change going beyond COVID-19 as well, because we realized that we don't really need to be physically attending. As long as 9 o'clock bang on, you are there at work, and you can deliver something from your own comfort of your own home. You don't really need to come to the workplace and be crowded there. So look at your office space there, just really everybody has to be there. Then introduce a system of where there is not a lot of cross transfer or transportation. So what we have done, we have introduced a one-way system in the building. So most of our systems and wards, they are now one-way. So people don't have to really come back and cross each other. If you got massive corridors, then it's fine. People can, as long as they can maintain a distance, then that should be okay, but one-way system does work. We have done a lot of marking on the carpets, in the floors, corridors, even in the office spaces as well, that this is 2-meter mark. So you should not be getting into somebody's personal area of 2 meters. So trying to stay away from by at least 2 meters. Use of appropriate PPEs, that's I've already covered as well, but how to do the donning and doffing, that's important as well. You don't want to be leaving stuff that might infect other people. So a proper way of taking off the PPEs is important as well. I'll give you a practical example. We are using face masks, and these face masks are fluid resistant ones. Obviously, when you have to be in where aerosols are being generated, you should be using FFP3s or N95 masks. But for normal day-to-day, now it's a requirement that every person in the workplace has to be using a mask. But does that mean if you go to maybe a table when in a communal area, when you're eating something there, you should not be taking off your mask and put it on the table. You should be disposing it off, because that surface has become a potential contaminated place. So appropriate use of PPEs is fundamental. Another thing which employers can do, and it has got some cost implication, but if you look in the longevity of the model, that does help, is introduce testing for the COVID and also for the antibody testing. We are doing it now. We are getting everybody tested. And I've been told very recently that Royal College of Surgeons have now given an advice that everybody should be getting tested weekly. So that's another way of doing it. A lot of people have come back as having antibody, which gives them a relatively more resilience towards not getting seriously affected. But a lot of people, they are not even exposed, so there's no immunity there. So swab testing as often as possible, and to get testing for the antibodies. That's a way a lot of employers are doing it, because that helps them to find out which staff are safe to be brought back to workplace. I think these are practically doable things. Another thing which, before I forget, is the use of glass screens, or perplex we call it. So all the areas where you can actually put some screens, like reception areas, you must do that. Thank you for the time.
Right. Thank you, Aamir, for all these guidelines. And at least in my clinic, I will ensure to get all these things done for my coordinator and all our listeners. They heard all the details. So obviously, all these things are going to be helpful for every one of us. So next, Monazza, I wanted to ask, like, all of you must have heard that, especially in our country, there are so many rumors and myths related to the COVID-19 that there's so many videos you can see on the social media that there's no corona and doctors are deliberately killing patients. And would you believe it? Someone even sent me a video. Like, I was like shocked that they even know that I'm a doctor. Even then, there's this patient lying in the hospital bed and someone's killing him. And the caption goes, कि कोरोना के मरीज को जो है वो खुद डॉक्टर मार रहे हैं. So now when we are like, chalo, I am doing ultrasound, but think of those who are working in the corona wards, in the quarantines. So in such a situation, Monazza, how can one remain resilient with all these things going around you?
I mean, first of all, Sabine, the situation you mentioned about rumors and what is coming on the social media, I think it's not only the situation in Pakistan, I think it's all over the world, but I think we are a bit different. And and we go a bit to the extreme, unfortunately. I mean, in Qatar, like here, I mean, there are so many mayas, so many exposure. I give you one example. I had just recently seen a patient who had like 13 members of the family came positive in one day. They tested 13 members came positive, and she delivered. So I mean, when I was talking to her, her mother-in-law was there, and she said to me, "Doctor, it's all propaganda. There is no coronavirus." I said, oh my God, like really? You got 13 members came positive just because you came negative. I mean, there is no coronavirus. So this is kind of, unfortunately, is the situation is everywhere. And that is why one of the reason, or this is one of the recommendation to stay calm and to cope is to not to pay much attention to the social media. You need to be looking at authentic source of information if you want information. If you're looking at an updates, you should constrain and avoid yourself getting these kind of overwhelmed by these kind of videos and stuff like that. But having said, those things come up, and we need to, I mean, build up resilience, and we need to be strong to deal with it. So the big thing is like, I mean, it comes against that we as colleagues, we need to support each other. We need to show empathy to ourselves that, hey, we are doing a good job. We are the frontliners. We are doing our best, what is available in our hands, and we are doing to our best of our capabilities. We don't need to get into the guilt kind of mode. Like Aamir mentioned, there's a huge problem which the doctors or healthcare professionals in general are getting, because they have to make very tough decisions. That's on one side, but it should not affect you in terms of you putting your life in the front and you're dealing with the most stressful situation at the moment and fighting with the enemy which you can't see. So we should so other than supporting each other, I think we need to focus and concentrate on our self-care. Make sure that we have good energy levels, we are sleeping well, we are eating well, we are doing physical activities and exercise. So physically, we are building a strength to handle with all these kind of stresses which are thrown at us. And I was reading is, I mean, what make a good resilience? I mean, and how it makes us be a strong resilient person. And one of the thing is like, I mean, other than being optimistic and stay on the positive ground, is also don't forget sense of humor. And there was I think YouTube video kind of gone through. I've kind of forget about half of it, but it's just like that, the one you mentioned, that they're killing the patients in the hospital by giving the injection, and they're sending the bodies to the US. So somebody said, yes, of course they are sending it to the US to do a research on them, then what sort of bug is in their brain, which is making them do things the way they're doing, and they can't follow the simple instructions, something like that. So this is so we need to keep that sense of humor in them, and we need to keep telling ourselves we are doing a good job. We are doing our best. We need to support each other and be there for each other. I think that's the best way forward. Along with that, continue, nurture yourself, do some problem solving, and establish some realistic goals. Things which we can do and the things which we can't do. We can't change the system. We can't stop people talking. We can't stop the news coming on the media. So the best is that we deal with the situation by telling ourselves that what we can do, what we can't do, and what we should look and what we shouldn't let affect us.
Thank you so much, Monazza. I feel at the moment I'm feeling positive after getting your answers. Thank you so much. So Aamir, at the end, just to sum this discussion, I would like to have some advice on how to building resilience on a daily basis. Like if you could stress on the role of exercise and a healthy diet, meditation, so we could get an idea about that as well.
I think it's been covered pretty much through Mona's very kind of thorough response to the previous question. Uh, we need to identify our strengths. So our locus of strength might not all be same for everybody. So we really need to know where we draw our strengths from. It could be your family, it could be your children, it could be workplace, it can be a schedule, or it can be any other activities like you mentioned. Some of the constructive activities we definitely need to adapt is healthy eating. Definitely doing some kind of physical activity or exercise is a must. See, when the UK government put the lockdown, the only thing they allowed was 1 hour of exercise. So exercise is so important. So we must definitely be still actually bringing that healthy aspect of our day routine in those lockdown situations as well. Meditation is really important, and there are different modes of meditation. You have to really give yourself into an area of unknown where you draw some calmness and you draw some serenity in your life. And this can come from some kind of therapy. It can come from yoga. It can be anything. But I think a lot of us we have got a very strong belief in religion, and in this difficult time, I think we should not be forgetting it. We all actually, whenever we are in pain, of physical or emotional, we actually are drawn to our Creator. And I think this is the time when we cannot really forget it. I'm sure attendance to the mosque would have gone massively high if the mosque were open. But this is our normality. It is a form of meditation, but religion is crucial. Definitely draw yourself more into religion. Ask for Allah's forgiveness and really kind of focus yourself on the positive aspects of life. As I said before, I'm repeating it, and this is not something which people don't know. People are possibly going to be getting exposed to this, but not everybody is going to be seriously getting infected. We need to identify the high risk people and try to prevent them, or at least create a space in our healthcare facilities that when these people become unwell, we should have enough resources to provide them the optimum care when they need it.
Thanks, Aamir. Definitely, we cannot undermine the importance of religion, and especially in such a situation, which the whole world is coming across through this. So, just to end this discussion, thank you once again, Aamir and Monazza, our experts, and we had really great advice and guidelines from both of you. And there were so many points. I would ask Farhan to sum them up briefly. So, thank you once again.
Thank you.
All right, everyone. I think this was a very informative session. So I made some points for our group to actually what they have mentioned starting, and they're mixed between Monazza's recommendations and Amir's. And first point that was emphasized was prevention. You have to continue to follow the method of hand hygiene, social distancing, and wearing masks when appropriate. It is it is what it is. You have to make sure that you continue to extend that precautionary measure as much as possible. Number two, have a realistic routine in your life. The routine will bring some sort of control back. We have lost our jobs controls, our financial health is in crisis, but all of that can be improved slightly by having us a better routine. I would also say, I was mentioned to utilize this time with your family, cherish it, enjoy it, make a routine out of it, or create memories for future. I would tell you here, one of the interviews I did yesterday with an oncologist at my hospital, and she's been taking 1 day off from her regular day of work from clinics. She's spending that time cooking with her kids. She has three grown up, school going kids, and she's been making dishes. And she said that was something that she never knew would enjoy with her kids, and that routine has helped her. She said in the evenings we are playing board games, and that has actually we've become very competitive in that. And so making those as part of your life and routine is important. A healthy diet has been mentioned, so I'm not going to go detail into that. But Amir mentioned about going outside in the nature. You know, that's another way of relaxing your body. Nature has a way of healing. It is when you go out in a park, when you sit outside in open fresh air, take deep breaths, that would take away a lot of your stress. So consider that as an option. When you're not surrounded by people too close to you, there's unlikely chance that you are actually getting exposed to COVID. Also, sleep has been mentioned. An important way of sleeping is actually making a time routine. Go to bed at the same time, wake up at the same time, even if you are working from home, because that routine, that circadian rhythm is actually important for us. Also, it has been mentioned briefly about meditation, deep breathing, and whatever you are feeling comfortable, um, get to that point. As Amir said, and one of my friends I talked to, and she mentioned a trip she took to Fiji about 20 years ago, and she remembers one night sitting in the dark, with looking up on the sky with billions of stars. And she said that to this day, during this crisis, that day, that moment actually brings her peace back, relaxes her. So I would say, think back a time and a memory that you actually felt really happy, relaxed. Could be a time with your parents, could be a vacation, could be anything. She also mentioned reading fiction books. She said she has always been a fiction reader, but finding good books actually takes away from your current day-to-day situation, and it's healthier than watching Netflix all the time, but breaking away from your day-to-day routine, which is too much stress. And the last things that I was making note of was mentioned about is to don't go too hard on you. One of my colleagues actually called in to take a day off on Monday unannounced because she said the stress was getting on her. She's a physician. She had a full day of clinic. But on Sunday night, she realized she was not in a mental health capacity to take any more stress. She needed an extra day to be with her family, to be with her kids, be herself and be relaxed. And she took that day. So don't be too hard on yourself. And if you need a day off to reflect upon, to give yourself time to rejuvenate, give yourself a chance. So those are great points that you all guys raised, and thank you for sharing the time. I'm hopeful that a lot of physicians, not only in Pakistan, but all over the globe, whoever have the access to this video will find it useful. So with that, thank you so much for your time and your expertise.